introduction, Laura. It's a pleasure to be here today, and quite fortuitously on World Sight Day, no less. What a perfect day to be talking about how we can better empower the blind and visually impaired in our state, and make vision and eye health a bigger priority for ourselves individually and for our community at large. We've got a lot of great material to cover. There's a lot of material just to talk more about where we are as a state with vision health in South Carolina, and I want to make sure that we dive into the services and the solutions that we're offering at Lions Vision Services so that we can talk about ways that you can get involved, ways that you can help, and ways that you can support us. We're very excited to be here to commemorate World Sight Day today. We have a little bit of technical difficulty, so while we get started here, I'm really excited to introduce a very special guest for us. We have a number of leaders from our Lions Club district and multiple district with us today. We have our current international director, Dr. Diane Pitts, who's with us today, along with her husband, Dr. Joe Pitts. We also have our current district governor for the upstate, District 32S, District Governor Jim Barbary. First Vice District Governor, Linda Rumsey. And second Vice District Governor, Randy Culberson. So we're excited to have our leadership represented, and Dr. Diane Pitts, has a special presentation to make from the Office of the Governor of the state of South Carolina about today's World Sight Day. Dr. Pitts.
I mean, this is fortuitous, and he can fix his problem while we are reading this proclamation. I am so proud to be here today, and on behalf of Governor Henry McMaster, read this governor's proclamation from the state of South Carolina. Whereas approximately 1.1 billion people worldwide, including over 138,000 South Carolinians, experience vision loss, primarily because they do not have access to eye care services. And whereas experts at the American Foundation for the Blind estimate that the number of blind and visually impaired people living in the United States will double by the year 2030 without effective intervention. And whereas over 90% of those with vision loss live in low and middle income communities, and whereas unaddressed poor vision results in a global economic productivity loss of $411 billion per annum, including a more than $2 billion impact in South Carolina alone. Whereas over 90% of vision loss could have been prevented. Whereas the leading causes of vision loss include uncorrected refractive errors, unoperated cataracts, age-related macular degeneration, glaucoma, and diabetic retinopathy. And whereas poor eye health leads to increased risk of mortality. Whereas children with a vision impairment are up to 5 times less likely to be in formal education and often achieve poorer outcomes. Whereas the burden tends to be greater in rural areas and for older individuals, women, people with disabilities, ethnic minorities, and indigenous populations. And whereas with the theme, Love Your Eyes, the 2021 observance of World Sight Day helps raise awareness on the global issue of eye health. Now, therefore, I, Henry McMaster, Governor of the great state of South Carolina, do hereby proclaim October 14th, 2021 as World Sight Day throughout the state, and encourage all South Carolinians to recognize the vital role eye health plays in a brighter future and improved quality of life. Signed, Henry McMaster.
Thank you so much, Dr. Pitts. It's a real significant privilege for South Carolina to be represented on Lions Clubs International's Board of Directors. That's a fairly difficult position to land. So we appreciate your leadership as our director with our International Association and presenting that proclamation from the Governor of South Carolina. We're going to talk about advocacy and about what we can do to elevate the prominence of vision and eye health in our communities. But it starts with things like this. It starts with awareness. It starts with initiative. It starts with our leaders taking action to make sure that our communities prioritize vision and eye health. You heard some staggering statistics, and we're going to dive into some of those in more detail to provide some context for what we do at Lions Vision Services. But the thing that's most important to remember about eye health is it's going to touch almost every single one of us. 90% of all vision loss is preventable, and almost everyone is going to be impacted by vision loss or have a family member that's impacted by vision loss at some point during their life. And that prevalence is only going to increase in the coming year. Every major form of vision loss is set to see an unprecedented spike in its prevalence in our community by the year 2050. And as we heard, just within the next 10 years, the number of people that are experiencing blindness and vision loss is going to double without effective intervention. The trend is not moving in a good direction. It's driven largely by the increase in our aging population. So we have to start taking action today, right now, to prepare for the coming decade. We've seen over the last year and a half what a burdened healthcare system looks like in handling a health crisis. We have the writing on the wall now to start thinking more proactively about ways we can address this. Because again, this is going to impact every single part of our life. The United Nations General Assembly passed a resolution earlier this year that integrated eye health into our Sustainable Development Goals. We think first about eye health being a component of good health and well-being. That's the third Sustainable Development Goal. But the reality is, without our vision, none of these other goals can become a reality. We have to address poverty, and in order for us to do that, we know that 90% of vision loss is in low and middle income countries. We know that the poorest people are the ones that are left farthest behind, particularly when it comes to vision loss. We can address hunger by addressing vision first. 46% of household incomes will move up an income bracket if they have access to free and high-quality cataract surgery. We know that vision health is related to our general health and well-being. Poor eye health can increase our mortality by 2.6 times. Quality education is something that's essential for us to address in the coming decade. And we know that glasses can provide effective intervention for students to make that education more of a reality. Children with vision loss are 2 to 5 times less likely to be in formal education settings. We have to make sure that our students in our classrooms are equipped with the vision resources to succeed. We know that vision disproportionately impacts women and girls, so we have to take that into consideration when we're talking about the impact on our community. Decent work and economic growth. Cataract surgery can increase household capital expenditures by up to 88%, and just providing a pair of glasses can increase workplace productivity by 22%. We have to focus on reducing the inequalities that we face in our community, and we know that vision health disproportionately impacts minority communities, as the Governor's proclamation pointed out. We have to focus on sustainable cities and communities. Imagine driving on 385 here in Greenville in rush hour traffic with somebody with unoperated cataracts. You're 2.5 times more likely to get in a car accident with them. We certainly want to create safe communities. Climate action is one that is perhaps less obvious to people from the outset, but the health sector, including eye care, is responsible for 4.4% of all greenhouse gas emissions. And the impact of our environment comes back to affect our health as well. So climate is something that is both impacted by the health industry and affects our personal health and well-being, and can be a driver for decreased eye health. Partnerships are essential to every aspect of our lives, and certainly for vision health as well. We take this particular goal very seriously at Lions Vision Services. On World Sight Day last year, in 2020, we created the Palmetto Vision Alliance, which is our state's first and most comprehensive coalition of vision health partners. Whether you're a nonprofit, a government agency, a healthcare professional, or just an individual that's working with the blind and visually impaired. We bring all of those stakeholders together on a quarterly basis to collaborate, to maximize resources for blind and visually impaired persons across our state, and to start thinking more strategically and comprehensively about what we can do in South Carolina to create a strategic plan for vision health. We're a member ourselves of the national version of this type of coalition, which is the Vision Serve Alliance, and operates on actually an international scale to bring these nonprofit and healthcare partners together for the cause of vision. And we're a proud member of Together SC, which is South Carolina's nonprofit coalition. So partnerships are one of the keys to creating successful intervention for vision and eye health and for helping the blind and visually impaired. We have to think collaboratively. We can't stay locked in the silos of our own lives and of our own organizations and corporations. We've got to reach outside, reach across the aisle, so that we work more effectively as a team and as a community. We have to do this because, again, vision health is going to impact our general health and well-being. You can see across the state, the communities that have a higher percentage of their population with a vision loss or vision disability from the CDC are the same communities that are more likely to be unhealthy communities. These are this year's health outcomes by county from the Robert Wood Johnson Foundation. Those same communities also happen to be the communities that are most likely to be experiencing poverty in the state of South Carolina, which was underscored by a recent study from the Sisters of Charity Foundation. There's a thread here that links vision to every other part of our lives. People with severe vision impairment are more likely to have diabetes, arthritis, and mobility issues in the state of South Carolina. And we know that vision loss is related to a host of other health issues, such as depression and isolation, stroke, hearing loss, chronic kidney disease, balance problems, falls, and risk of early death. Vision has to be addressed first if we're going to adequately empower and enable the blind and visually impaired to better manage the other aspects of their life. Vision is an essential part of our quality of life and our connectedness to our community, and without it, we will not create an effective roadmap to a sustainable and thriving community. We also know that this is something that significantly impacts the older population especially. You can see a breakdown here of individuals by age in the state of South Carolina that experience blindness or vision loss. Again, it emphasizes that women experience vision loss more than men, and that the older you are, the more likely you are to experience vision difficulty. Mental health has been a heightened concern over the last year as we all wrestle with navigating a global pandemic, and there's an intersection here of vision impairment and mental health. We know that people with vision loss are more likely to have significant depression. Having diabetes as well also doubles the risk of depression. This is a thread that is tied to every other aspect of our health and of our well-being. And it affects different communities in different ways. This is an important part of our approach at Lions Vision Services. While the causes of low vision are pretty consistently caused by cataracts, more so than other vision conditions here, those are the green sections there, we notice that the causes of vision loss are different based on the type of ethnic community that people are coming from. White people are more likely to go blind due to age-related macular degeneration, whereas black people are more likely to go blind due to cataracts. And Hispanic persons are more likely to go blind due to glaucoma. This affects and this drives how we approach our eye surgery program at Lions Vision Services because we have to think intentionally about the types of vision loss that our clients and that our neighbors are experiencing and make sure that we're bringing the most effective solutions possible to bear on these challenges. We also have to better integrate vision health into our public health initiatives. The CDC underscores that largely due to competing priorities and limited funding, vision health is often pushed out of public health initiatives for other health issues. Not that those are not important, but if we ignore vision loss, we're ignoring a major component of our general health and well-being. And we know that there's a tie to the coronavirus. Things like chronic diseases like diabetes are exacerbated by the coronavirus and are more likely to lead to vision loss down the road. There's a host of primary, secondary, and tertiary benefits to better integrating vision health into the public health infrastructure, but this involves nonprofits, government agencies, healthcare providers, and the community at large, better working collaboratively and transparently to address vision health. And again, there's a cost tag to all of this. This is not an abstract problem. This is something that's setting our economy and our state and our competitiveness on the global scale back by not addressing it. $411 billion a year, over $2 billion in South Carolina alone. And prior to the age of 65, the biggest cost burden for vision loss falls on individuals. That is a major concern for how we provide vision health resources to the people that need these services. This isn't going to be solved by a government program or by insurance coverage. This is something that we have to more creatively and holistically address on a local and a national scale. So what can we do at Lions Vision Services to help with this? We have an array of services that since 1969 have been helping our state's blind and visually impaired population. We intentionally focus on a broad approach of empowering people. We're not looking for handouts, but rather hand-ups, helping to comprehensively address the circumstances in an individual's life through the lens of vision health. And our board is very good at keeping a high-level strategic view of how we empower those that we serve with these services. We were created initially by the State Association of the Lions Clubs here in South Carolina back in 1969, and most of our programs, including our flagship eye surgery program, have decades of proven results and experience in effective service delivery. So these are perspectives, this is experience that is offering scalable solutions to how we can better address vision health in South Carolina. I want to introduce you to somebody that really typifies what we see in vision health at LVS. We can talk all day about statistics and we can run out the clock on that, but it really comes home when you understand the personal lives that are being impacted by this and the individuals that are in need of these services. Robin is an upstate resident in nearby Union County here in South Carolina, and her income, her job, doesn't just support her, it also supports another family member in her household. They're reliant on Robin's income. But Robin started to notice that she was losing the full function and use of her sight, something that threatened her job, something that threatened her livelihood. But without access to health insurance, without financial savings, living well below 200% of federal poverty guidelines in our state, Robin had nowhere to turn. We were the last line of defense when Robin came to us. She had exhausted an array of other options and other avenues, and it was with that desperation for assistance that we were first introduced to Robin. Robin is one face behind hundreds of South Carolinians each year that need and are not receiving adequate vision health services. We thankfully offer an array of services at Lions Vision Services, from basic preventative measures like eye screenings. These are not formal eye exams where your pupils dilated, but nevertheless, vision screenings can be an early detection tool that can help identify, particularly in young children, vision loss issues that can be addressed sometimes with very minor intervention. We have an affordable eyeglasses program right now in counties where local Lions Clubs don't exist to provide eyeglasses assistance to residents of those counties. Right now that's Calhoun, Edgefield, and Marlborough counties where we offer eyeglass assistance to individuals. And as we heard through some of these statistics earlier in the program, sometimes that's all it takes is one pair of eyeglasses to turn somebody's life around, to change somebody's performance in the classroom, to improve workplace productivity. But sometimes more substantial intervention is required when correctable vision loss requires an eye surgery. These services start at $1,500. These are significant financial burdens. We're able to negotiate a significantly discounted rate through our network of ophthalmologists and anesthesiologists and surgery centers all over South Carolina. We have over 80 partners that help us by donating a portion of their services because of the low-income demographic that we serve in the community. So we're able to leverage that support. An eye surgery that would cost us, if we had health insurance walking in, somewhere in the neighborhood of $3,000 to $4,000 out of pocket, can cost an LVS client as little as $1,500. We can usually leverage at least every $1 that's donated into an additional $4 or more in services that we can provide to our clients through this program. And these eye surgeries permanently change people's circumstances. They set people on a path to not have to worry about vision loss again in the future. And they're often the services that are the most out of reach for the people that we're serving due to the high cost of those services. But sometimes vision loss is permanent. Sometimes there's nothing that can be done. Sometimes surgery isn't an option, and therefore we have to transition to a rehabilitation perspective. We do not do formal vision rehabilitation. We know a lot of good people in South Carolina that are doing that work, and we can refer people to those programs when needed. But one type of vision rehabilitation that we do offer is low vision equipment. This is utilizing technology-based solutions that can help empower somebody who's dealing with permanent vision loss to be able to live a safe and independent life. This could be something as simple as a magnifier to help you read something on the coffee table or at home or at work. It could be something as sophisticated as an earpiece that's giving a blind person audio cues of their physical environment to tell them when they're approaching a sidewalk or a curve or a stairwell or a dog that might be walking next to them in a park. This is a service that can truly take the clients that we're serving and empower them to not be reliant on others for transportation, for navigation, for assistance. It has a profound impact on their quality of life. We mentioned, too, that hearing loss often accompanies vision loss, and so we have a hearing aid program to support that need when that arises with the clients that we're serving. But we also have recently taken on an event that's known as the Santee Blind Fishing Event. This takes place on the shores of Lake Marion in the lower part of the state in Santee, South Carolina. And it's an opportunity each year for people that are experiencing blindness or vision loss to have a break in what's often a monotonous and dry routine that they have to work within to get things done in their life. This gives them the chance to connect with other people that are experiencing the same things, the same challenges, the same emotions, the same feelings that they are. And it allows them to create new friendships, new connections, and it ultimately provides a tremendous enrichment to their life. And it's, again, something that we're starting to bring back in April of 2022. We're excited about that. And then I already mentioned our Palmetto Vision Alliance that we manage as well as a state leader and facilitator for vision health partnerships. So we try to provide a comprehensive array of services so that when people come to us, we can point them in a number of directions to get the help that they need. We take the client's voice and pair that with the expertise of a healthcare provider so that we're maximizing the impacts that these services are having on our client's life. And people don't feel like they're being pushed through a system where you have to check all the right boxes and you have to fit into a mold. We're meeting people where they are and helping them to move to a better place of empowerment and independence and well-being. We've found over the years that a lot of our programs disproportionately serve large percentages of the minority communities in our state as well, which again allows us to make sure that we're getting these resources not just to those that have the easiest access to those resources, but to those that have the greatest need for those resources. Most of our clients have an annual gross income of $19,300 a year with 2 dependents in their home. I can't imagine living on $19,300 a year, let alone having to pay thousands of dollars for an eye surgery to save my sight on top of that. These are people with significant need that are being assisted here. And that brings us back to the face behind those clients, to Robin. Thankfully, we were able to quickly qualify Robin for service through our eye surgery program, and we were able to provide both of the cataract surgeries that she needed. Now, she doesn't have to worry about losing her sight. Now she can continue to work, she can continue to provide for her family, and ultimately her message is a message of thanks to the donors, to the partners, to the individuals at Lions Vision Services that came together to save her sight. It takes a community effort. We have an extensive network of healthcare partners over the state that again take every dollar that's contributed to LVS and leverage that into another $4 in services provided. We're increasingly focused on a results-based accountability framework for our reporting. This is a gradual transition that we've been making over a few years to be more data-driven as an organization. And it allows us to not only look at the quantity of work that we're doing, but the quality of that work. And asking the question, what are we really changing? What's really the impact from a measurable standpoint of the programs and services that we're providing? You might remember from an earlier slide that African Americans are more likely to go blind because of cataracts. Well, we found that 74% of African American clients at LVS are being treated with cataract surgeries. So we're effectively delivering the solutions that these individuals need that are addressing the biggest needs in their community. So we're excited about that opportunity, to say nothing of the sheer scale of services that we're providing here. So that leaves us with the opportunity to say, what can you as individuals do to support this work? What can you do to get involved? How can you be a Knight for the Blind? You'll hear us use that phrase a lot. If you're unfamiliar with its origin, Helen Keller challenged the Lions Clubs in 1925 at the International Convention to be her Knights of the Blind in the crusade against darkness. We feel that's a really exciting mantra for us, and so we've adopted that and continue to champion that today. And I don't want you to think that we're just after financial support. That's certainly a big part of it, but we all have something meaningful to contribute. And if we don't have the social, moral, intellectual, and relational capital to back up our financial capital, the solutions that we have aren't ultimately going to be as effective as they could be. We need your help. We need all these other types of support to get the word out about these services, to help come alongside the individuals in our community that are experiencing blindness and vision loss, and empathize with where they are, understand what they need, and understand how to meaningfully and intentionally provide those services for them. So think about all the types of ways that you can support us. One of them is by picking up one of the brochures on your table about Lions Vision Services and taking that back home to your office or to your family, and just using it as a resource to share with others. Our good friend and District Governor Jim Barbary runs a printing company up here and was generously sponsoring that, printing that brochure in front of you. So we thank you, Jim, for your help with that, and we want to use this as one way to get the word out about what we do and how others can get involved. Another thing you can do as part of World Sight Day this year is make sure that you are scheduling an annual eye exam. The frequency of that exam is going to vary based on your personal circumstances and on a host of other health factors that might play, and your age, but at least every 2 years. We should all be getting our eyes checked. And that type of regular monitoring of our vision health, particularly for those of us that are able financially and logistically to do that, will help head off a lot of the bigger problems that we face in the vision health industry. Of course, I would be remiss if I didn't tell you how to financially support us at Lions Vision Services. If you want to become a Knight of the Blind right now, and you have a smartphone with you, you can text Sight First, that's SIGHT FIRST, to 44321 right now, and make a gift that will have a material impact on the blind and visually impaired in your community. Greenville County is one of the counties where we provide the most services across the state to the people that are experiencing blindness and vision loss. So you can rest assured that those dollars are being well stewarded to make a difference in those individuals' lives. Finally, we want to ask you to help us make our leaders accountable to taking a stand on blindness and vision health. We want you to ask your member of Congress to join the Congressional Vision Caucus. This is a nonpartisan and bicameral group because vision and eye health is a bipartisan issue that is going to be impacted by legislation in both the House and the Senate. This is a largely symbolic gesture. This is not a caucus that requires a financial contribution. It's not a caucus that requires a huge time commitment. It's largely a way for your legislator to be informed about vision and eye health needs. And we have reached out to every single member of South Carolina's congressional delegation to request an opportunity to talk with them and ask them to join this caucus. I'm very pleased to say that Congressman Jeff Duncan and Ralph Norman have already committed to joining this group. And we have been able to meet with others, including representatives from both Tim Scott and William Timmons' office. But those individuals are undecided and are not committing yet as to whether or not they will join the caucus. William Timmons is your representative here in Greenville County. We need you to call his office and make sure that he knows that vision and eye health is important to you, and you want to see his name on the Congressional Vision Caucus roster. A number of other legislators are still unresponsive to our outreach, and again, we have to do our part to keep this issue top of mind as we think about the impact that it's going to have on our community in the coming years. Make your voice heard and make sure that your legislators and your representatives are standing up for your values in Congress. I'll leave you with some of our contact information. We've got a great social media presence on Facebook, LinkedIn, Twitter, Instagram, and YouTube. I invite you to follow us there. We've got a newsletter that you can sign up for on our website and a host of other information on various virtual platforms. So we really thank you for this opportunity to share our work with you. We hope that we will be able to continue partnering with you as Knights of the Blind in our crusade against darkness. And thank you for helping us celebrate World Sight Day by elevating the topic of vision and eye health. Thank you. Are there any questions? Yes, ma'am.
So I saw where you guys would provide frames and that kind of stuff. Would those be brand new? Do you do eyeglass frame drives or collections from the community?
That's a great question. So the question for the folks that are joining us online was, do we do eyeglass drives to help collect used frames? What type of frames, more specifically, are we providing for our eyeglasses program? We do collect used eyeglasses. There are some spots that Lions Clubs manage in the local communities here. I would have to double check on the closest one to Greenville. But we collect them at our headquarters in Columbia as well. There's a pesky law on the books that prevents us from being able to reuse recycled eyeglasses in the United States. So we work with foreign missionaries to repurpose those eyeglasses for use in overseas medical clinics. We make sure that every pair that's donated to us gets to a place where they can go overseas and provide vision health for those in need. For our program at Lions Vision Services, we're providing a new pair of glasses, but a very basic pair of glasses. They're not going to have fancy transitions, or we will do bifocals, but not trifocals. But it's a basic pair of prescription glasses that will meet the vision needs of those individuals.
So on average, a pair of glasses with a single prescription lens, what does that cost about?
Yeah, it's going to vary based on the optometrist that we're working with. Some optometrists for the exam and the glasses combined, that's going to cost us at Lions Vision Services about $290 per person. But just for glasses, if we already have the prescription in hand, those can be as accessible as $50 a pair, based on who we work with. So it varies a little bit.
Those would be provided by whom?
By us. So we, at Lions Vision Services, we will pay for the eyeglasses and the frames, and if needed, for the eye exam for those individuals. Again, so to meet the criteria for any of our programs or services, except for screenings. Screenings are free and available to anybody. All other clients have to be a South Carolina resident for at least 1 year and have to be living at or below 200% of federal poverty guidelines. Most of our eyeglass work is going to be connecting people with their local Lions Club that often have budgets or programs that will provide those eyeglasses on a more local basis. We're working primarily in Calhoun, Edgefield, and Marlborough counties right now where there are no Lions Clubs, and in other communities where we're able to secure regional funding.
Okay, last question. And I don't want to monopolize you, but have you ever considered trying to partner with somewhere like Warby Parker, where their frames are really nice frames, but they don't cost. I mean, I have friends that have like 6 different pairs.
Yeah.
And they would just need the pupil distance or whatever. It's just a thought.
Yeah, we're always open to talking to new partners. The reality is there's a lot, despite our network, there's a lot of people out there that we aren't connected with yet that we could be. For eyeglasses in particular, it's a relatively newer program for us. It's something that we've started just within the last year or so. So we would love to learn more about how we could meet with those potential partners and do more work with them. Absolutely.
Thank you.
Yeah. Yes, ma'am.
Is your, the technology, is it like on a lending basis, trial basis? How does that work? 'Cause
Good question.
I saw the e-site, and
Yeah.
my son is, and also, y'all didn't mention, and I think this is the population that really gets underserved, is the multi-handicapped population.
Absolutely. The question was for our low vision equipment program, are those pieces of equipment lended out, or what does the process look like for that? The answer to that question is they are lended out on a lifetime basis. Lions Vision Services pays for the equipment and then leases it basically to the individual for as long as they need it for the rest of their life. We do try to make sure that in the event that it's no longer needed or that individual is no longer here, that we're able to regain and repurpose that equipment because it is expensive, but it's leased out on a permanent basis.
So if my son's on SSI,
Yeah.
my husband and I are retired, so something like that, when you say below poverty level, is that considered?
We look at total household income to determine that and then compare that to the federal poverty guidelines that are put out each year. So anytime people are interested in learning more about specific case studies for clients or inquiries, please give our office a call. Our Executive Vice President, Wynn Fitzgerald, manages all of our programs and operations. She would be happy to talk with you about specific situations.
Okay.
Any other questions? All right, well, Laura, thank you so much again, and thank you to the Barbara Stone Foundation for helping to put this event on. We appreciate your work in the community and appreciate the chance to celebrate World Sight Day with you all.
Thank you.
And please join us to network and